Hi, everyone. Thank you for logging in tonight. I am very happy to welcome back Nancy Schwartz. Nancy has been doing these Medicare talks for us for several years, and I learn something new every time. I turned 65 this year, and I received, I don't know if you can see, over 50 pieces of mail about companies that want to deal with my Medicare situation. So just recycle them because Nancy is going to put you on the right path. Welcome, Nancy. You're muted, Nancy.
Thanks, Joanne, and hi, everyone. It's really nice to be here with you tonight. So, you're probably here because you yourself have already received a stack of mail, much like the one Joanne has, or you're going to receive it soon, or you did receive it. And so the goal here tonight is to help you figure out how to match yourself, or at least to gather the information needed for someone like me or another professional to match you with the right Medicare plans. So you know you're doing the right thing. So you're well covered at a fair price. That's what we're going to do today. Just a heads up that 2024 has a lot of changes coming to Medicare due to the Inflation Reduction Act, which came into play, I think, back in the summer. There's some reforms that have already been put in place and others that are going to launch on January 1st. And I'll discuss those as we move along. Please note your questions as they come to you. If all of you add in the chat, I have no idea what she's talking about, help, Joanne will stop me and ask me for clarification. But if she doesn't see that, we're going to wait till the end of the session to answer your questions. So here goes. First of all, some of you have already met my dad, Manny, here, no longer with us, but he's the guy who motivated me to move from a radically different career of nonprofit communications into Medicare, something I never even thought of, believe me. But shepherding him through his elder years really made me aware of both the importance of access to the right medical providers and the right healthcare, and of course, coverage to it. And as well, how easy it is with Medicare because it's so complicated, because the language is definitely another language, unknown to all, the jargon, that it's very easy to make mistakes in finding the right Medicare plan or to overpay. So I hope what you take away tonight is going to help you to overcome those challenges. I'm confident it will. Just a note that Joanne will be sending out a summary handout, sort of a checklist or work plan that you can use. She'll be sending that out tomorrow morning, and the video recording of this session will be available a bit down the line as well. And Joanne will email you whenever that's up and running. So let's dive in. I am someone who works solely with Medicare for folks 65 and older. I consider myself primarily an educator, and secondly, a guide and a broker to Medicare plans. I represent about 15 insurance companies that offer a total of 135 plans. And just so you know, there's never a charge to work with an insurance broker. You may well know this from another type of insurance you have. You pay the same premium whether a broker guides and enrolls you, and then they are compensated by the commission that's built into the premium, or you enroll directly through the insurance company and they keep the premium. So just to set that straight. And let's dive into Medicare. The problem here is that not only when you first start Medicare, but on a regular basis, people lose access to the providers they want and necessary care. And in addition, they may overpay for healthcare and medications by very casually choosing or passively renewing supplement, advantage, and drug plans without knowing what coverage they really want and need, realizing significant costly changes that may have been made more than ever this year or 2024, and assessing alternatives. So that's the basic problem. If you're already enrolled in Medicare, I'm going to guide you how to assess your current plans against your needs and against alternative plans out there. If you're new to Medicare, you're going to learn the framework for decision making on what kind of approach or really what kind of plan you'll need to fill the gaps in what we call original Medicare, Medicare from the federal government. Believe it or not, what the truth is that very few people compare Medicare plans before jumping in. The Kaiser Family Foundation, which is one of the most trusted resources in healthcare research in this country, did a research project in 2021 that found that only 3 of 10 Medicare beneficiaries actually compared plans and assessed them against their own needs. That was 21. And now in 2024, the landscape is even more complicated. As I mentioned, there are big changes to the Medicare framework with more government oversight, a good thing. And that includes first-time checks on medication costs. But in response, as you may have guessed, there are dramatic responses by insurers, and I should have added here, pharmaceutical companies. Probably medical firms and hospitals and other healthcare institutions and hedge funds that own them will be jumping in as well to respond to these changes. So why do people just sit back and let Medicare happen to them? First of all, it's a lot of work and it's complicated. But most importantly, people just have no idea really what's changed, if anything, may not be aware that life changes they've experienced impact their healthcare needs, and they're just not going to be covered as well next year. They stick with their current plan, and they don't really know what they can change. Not to mention the rest of the stuff on the list. It's complicated. It's a pain in the butt. It's probably right up there with doing your taxes in terms of the things we don't like to do. Doesn't have to be so bad. Even if, as Joanne showed you, and this is her photo she shared with me, you are deluged with this kind of mail when you're starting Medicare, and every fall when you have, if you're on Medicare and you have that chance to revise your drug or your advantage plan, depending what approach you take. We'll get to a brief overview of how the parts and plans of Medicare fit together in a second. For questions about that, please contact me afterwards. That's a whole other conversation. So, but as you could see by Joanne's pile and the kind of stuff that you probably see if you're watching cable, or things like that ads you hear on radio, billboards, it's all over. Now, luckily, these ads, like, our friends J.J. Walker, the Medicare expert, right up there with Joe Namath, they're not supposed to be run this year with the same kind of misinformation they've been allowed to tout in the past, like get money back, get those extra Medicare benefits. But believe me, they'll be up there fast and furious. Last year, I even got some mail for my dad. Okay, this was This was in 2022. My dad passed away in 2018, and last year I got about 5 mailings for him, urging him to change his Medicare plan. So it's absolutely relentless. Let's frame up this discussion with a brief overview of the parts and plans of Medicare. Let's start over on the left with original Medicare. By the way, I won't be sharing the slide. So if there's any slide you want to, have a copy of, just take a quick screenshot of it as we go. And if you miss anything you want a screenshot of, just let me know and I'll be glad to email that to you afterwards. Anyway, on the left, we have the foundation of Medicare. And that's the original Medicare you've always heard of, the one your parents had from the federal government. That's comprised of 2 parts. Part A, which is hospital room and board. And that's all. That's not your care in the hospital. And then Part B, which is what you use most often, and that's your medical care, whether it takes place in the hospital, in infusion center, clinic. Also includes things like imaging centers, labs for blood tests, medical equipment. So that's that. But the thing is, and I'm going to jump ahead a second here and then come back to this slide. So anyway, here are parts A and B. People are really surprised when they find out that part A is just room and board. Okay, so that's usually a shocker. You heard it first. The problem with original Medicare is that it doesn't cover everything. So with original Medicare alone, you still have these costs. These are costs for 2023. We don't have the information on 2024 yet. That'll be released sometime in November, but you can bet they're going up. But what's most important to digest is what I've crudely circled there on the right. For every medical bill, you're responsible for 20%. And in most states, let's see, about 40 states, providers are allowed to charge up to 15% additional above the fairly low Medicare reimbursement rate, and that is your responsibility, those excess charges. So look at that. That's, if you put that together, that's about 32% of the bill is going to be your responsibility. So most people really don't want to pay that, and that's smart. It's really a bad risk to take. So there have been some private plans and approaches, 2 options that have been introduced to fill those gaps in original Medicare. The combo on the left, the Medicare supplement, aka Medigap, and the prescription drug plan, aka Part D, work together with original Medicare to provide comprehensive coverage. The alternative to that is what most of the advertising is about, and that is Medicare Advantage plans. And with Medicare Advantage plans, Medicare actually hands off the management of your Medicare to the insurance company behind your Advantage plan. And you have the insurance company then becomes the arbiter of your health care. They said every year your copays and deductibles has nothing to do with that chart I showed you before for original Medicare. They have their own limited networks and schedule of copays, deductibles, cost sharing. And these are not standardized in any way. The other approach that I briefly mentioned, Medicare supplement with a drug plan, works. The supplement, which is for the medical side of things, works just like original Medicare. You can see any provider you want who accepts Medicare anywhere in the US, every hospital in the US, never a pre-authorization or referral required. But they each have their places, their strengths, and their negatives as well. So this is the framework in which we're working for today's conversation. Now, with both approaches here, you are required to have a Part D drug plan. Medicare itself is just for medical. It does not cover at all. It does not cover medications. So you have to have a drug plan. If you don't sign up for one, you'll be penalized. And even after you sign up with them for one, you'll be paying that penalty for the rest of your life. And you won't have any coverage for those crazily priced drugs. So get a drug plan. So with an Advantage plan, the only kind you want to look at is one that has a built-in drug plan. That's called MAPD, or Medicare Advantage Plan with Part D. Or if you go for a supplement, you get what's called a standalone drug plan. And in effect, you have 3 plans like you see there, original, and 3 cards: original Medicare, your drug plan, and your supplement plan. Okay, so already you see that we're starting out with something that's pretty complicated. The pieces and plans and that choice alone, that's complicated. But get this, the Medicare supplements are standardized. They're developed by the benefits are developed by the federal government. They're standardized. Every Plan G has the same benefits, no matter what insurance company offers it, and will stay the same over the course of the years. New supplement plans with their own set of benefits may be introduced. But with drug plans and Advantage plans, it's changing every year. And what we're talking about when we're talking changing is cost and coverage, okay? So whether you're new to Medicare, or, as we're really focused on tonight, looking at renewing your plans, why we're focused on that is, as you'll see in a minute, we are just about to start what's called the annual enrollment plan. And this is the one time each year when folks on Medicare can change either their standalone drug plan or their Advantage plan. It would always be one or the other, to get one that best covers their needs and is least expensive, or the combination that does the best in both facets. Okay, so here we are. This is your one time. This is your one time. You may have seen stuff coming out. If you're on Medicare, you probably got emails, not only from private insurance company, but Medicare itself reached out saying new plans are up on Medicare.gov. I wouldn't even look at a plan for 2024 until October 15th. The information, the data on each plan, on cost and coverage is a mess and inaccurate. So hold off. Okay. While you're at it, so one time a year when people's attention is drawn to their Medicare plans, think about how your Medicare supplement is working for you as well. Okay, how do you know that this is coming up? Well, all of you already enrolled in Medicare should have already received what's called your annual notice of change, or ANOC, for a sexy acronym, letter outlining how your drug plan or how your Advantage plan is going to be changing for 2024. And then, as I mentioned, the plans themselves, 2024 plans themselves, are released and as of October 1st, and you can start making changes on October 15th. Those changes will go into effect on January 1st of 2024. So this is a sample annual notice of change. It's a pretty detailed document. It's not attractive. It's not easy to read, but you really got to do it so you don't fall for the annual Medicare plan switcheroo. Okay, so this is really the second key step I urge you to follow, and that is think about and put into action an annual Medicare plan checkup. This is the time, and if you don't take the opportunity now, or when you start Medicare, you won't know if you have the right plan, and you might discover, oops, costly and unnerving changes only after it's too late. You don't have to get there. Here's the first risk you take. And whoops, missing the T there. Premium year over year. And this is just something for you guys new to Medicare, soon to be new to Medicare, to focus on. Premium and out-of-pocket costs are going to go up. So your risk is that you may be overpaying if you stay on the same plan. That's really relevant in terms of your medications, whether you have a standalone drug plan with a supplement or your drug plan is part of your Advantage plan. Why? Well, the Inflation Reduction Act, which I mentioned earlier, is really introducing some important changes to try to reduce prescription drug costs for individuals on Medicare. Already this year, there was a cap put on the most used insulins at $35, which have made them accessible to a much broader range of people, which is really important since diabetes is so rampant. Starting January 1st, I'm going to show you a little bit more detail on this. There's going to be, for the very first time, a cap on what someone on Medicare has to pay out-of-pocket charges for medication. Believe it or not, there's never been a cap, never before. So, the people who, shape this act are really focused on making good health care, both the care itself and the medications needed to sustain it, accessible to all of us. Okay, I'm going to show the details on that in a minute. You may have read, and I just saw an article in the Times this morning, that this year the government has already designated 10 of the most expensive drugs out there. And these are medications that are used for things like, they're called biologics, most of the most expensive ones. They're used for a lot of chronic diseases. It could be MS, it could be rheumatoid arthritis, it could be Crohn's disease. Any of these things, people need these drugs to be healthy, but they've been available only at these crazy, crazy expensive prices. You see, because, and I should have said this right at the medication generally costs more when you're on Medicare than it ever has before, as crazy as that may sound. Anyway, these 10 drugs that were identified this year, the cost-cutting measures for those aren't going to be live until 2026, but it's good to look forward to. So let me give you a little bit of the information on how the way that drugs are covered is going to change in 24. And that's going to really show you why both insurance companies for drug plans and Advantage plans and pharmaceutical companies are trying to find ways to shove costs back onto individuals. So this is really complicated. Let's just work up from the bottom. We'll go into details if you're new to Medicare when we meet one-to-one. But what's important here, if you look at number 3, is this strange entity called the coverage gap or donut hole. That is now where your out-of-pocket costs are capped at a maximum of $8,000. Now, $8,000 is a lot of money. I'm not disputing that in any way. However, that cap for the very first time is really, really important. All right, really important. And that cap is supposed to go down to $2,000 on January 1st, 2025. And let's really all pray that it does. So what's happened is this last phase that's been in place forever, the catastrophic coverage period, now the plan has to pay more. But as I said, they're going to try and slip back the cost to you, whether it's in premiums or copays for your drugs. If not this year, then over time. So I want you to be vigilant about looking out for that. Here's a list of the drugs that are going to be, that have been identified for price reduction. Been identified this year. The reduction goes into play in 2026. And here's how the details on an annual notice of change look. So you see that with this drug plan, Cigna Saver RX, their premium is going up from a pretty reasonable premium of $1,330 to $1,950 for next year. So you might say to yourself, okay, that's not bad, but this is just an example. And believe me, those increases are definitely going to go up in the future, year over year. Here's an example of a Medicare Advantage plan and how that increases year over year. If you look at inpatient hospital stays, and remember, if you go on an Advantage plan, forget original Medicare from the federal government. This is your one and only health insurance. And you see how inpatient hospital stays here at the bottom, they're going to go up for the per day charge for the first 6 days from $250 to $325 next year, which is a pretty hefty increase as well. So there's a lot of change in coverage and cost. Don't forget, if you have a Medicare supplement, which is paired with a standalone drug plan and original Medicare, your premium is likely to increase as well. It doesn't increase on the calendar year, but it does increase on either your renewal year or whatever the company's renewal schedule is. And just to be very brief about this, people love their Medicare supplements and frequently say, I don't want to touch this. I love it. It's working for me. In most states, to change your supplement plan after the first one, you have to go through a review of your health history. It's called underwriting. So if you can pass that, though, after 3 to 5 years of staying on one supplement from one insurance company, if you can pass underwriting, you can generally save money. They reward their loyal members by make year-over-year increases that are really high, kind of like your mobile phone bill or your cable bill. You know, you have to switch to save money. If you can do it, it's worth a try. There are also situations like in New York right now, there were 2 main insurers that provided supplements there. One of them has retreated from the market. So, of course, the other one is now raising rates significantly. Just to bring this to your attention that this is something to keep a track of as well. The second risk in looking for a first time or new plan is that your preferred doctors, hospitals, or pharmacies aren't available. If you're enrolling, if you have a supplement, there is no network. As long as your providers accept Medicare, you can use them. Okay, it's only in places, there's a slight caveat there, in places like New York City, sometimes in Chicago now, there is a quota. Some people don't accept any insurance, including Medicare, and others have a quota of how many Medicare patients they do accept. That is legal. But other than that, Anybody that you go to, any provider who accepts Medicare is someone you can go to with a supplement. However, every Medicare Advantage plan, whether an HMO or what Advantage calls a PPO, which only means they have the same limited network. And if you go out of network, you're going to have to pay that bill directly. You will get reimbursed to some degree, but it's not going to be the amount of the whole bill. That limited network changes sometimes quite dramatically, even over the course of a year, and more so from year to year, because again, that's when providers are paying more attention, just like you are. Okay. Same with pharmacies. Drug plans, whether standalone or part of an Advantage plan, are connected. Each plan has relationships with certain pharmacies. That's become a lot more complicated now that, for example, CVS owns Aetna and all kinds of relationships like that. But you want to also, to some people, a pharmacy can trump the expense of a drug plan. Even, if a plan is more expensive, some people might go for a local pharmacy, but that's a preference you'll need to identify in making your choice. The third risk or area to focus on in plan selection or renewal is your medications. Are they covered? Do they require pre-authorization, which is always painful? And are there quantity limits, like 30 a month or less? So there is every insurance plan, including your current health insurance, if you're pre-Medicare, has what's called a formulary, which is a list of medications covered by your plan. Every drug on that list is categorized by what's called tiers. And the tiers range from tier 1, those are least expensive, and those are what are called preferred generics, the absolute cheapest to the insurance plan, and so on to you. But they go up through tier 5, which are specialty drugs. And as the tier number increases, so does the cost from the pharmaceutical company to the insurer, and of course, from the insurer on to you. Also, I didn't show you an example of this, but even if your drug is still covered in 24, your copay may increase. And I came across this wild example of this yesterday. As I have a client, she starts next month, even though I don't trust what I see online yet for 2024 plan. She's on one of those very, very expensive, what's called a biologic, because she has Crohn's disease. And I just wanted to see what was available for 2024. And the cheapest one this year was several thousand, over 10. Next year, it is $99,000. Insane, but the plan's gonna have to eat some of that, and the government's gonna have to eat some of that. The individual will be capped at $8,000 out of pocket each year. But you want to look at the copays for your medications when you're evaluating plan. It's not about premium. It's also about copay on the drug side. It's that combination that is the total figure you want to be comparing. So when you put those two elements together and follow the next key, this comprises a 3-step method for Medicare plan selection for the first time or each year, which I like to call an annual Medicare plan checkup. Don't sit back and forget about it. Health insurance doesn't let us do it. You know how much those premiums are increasing every year. By defining what's most important to you, because we know we can't have everything, and what your needs are, you're going to know what plan to look for and how to find it. first thing is define your Medicare plan needs and wants. What I suggest is that you inventory your healthcare usage year to date and in the past year. And these are some of the elements all outlined on the worksheet you'll get that are important to review. So of course you want to look at what's going on, what kind of treatments, medications, visits with providers you need now, and anything you know of that's coming up for next year. Lots of times I talk to people and a client who knows that they have a knee replacement coming up, or they have they're being tested for Parkinson's, let's say, and it seems like it's pretty likely they have it. So you got to put that into your considerations when you're looking ahead for Medicare and seeing what your needs are likely to be. I suggest that you actually write this down. It's going to be far easier to reflect back on and use when you choose your plan, or use somebody like a broker or the state health insurance plan advisors to guide you. And honestly, sometimes people, me included, when you put it down, you do it a little more seriously. Then you have to consider your preferences. Like, is there one ER or hospital if you have most faith in? So one of my clients back last December got COVID, got a very serious related illness, went to a hospital around here. I'm in New Jersey, right outside of New York City, had a horrendous experience in the hospital, which made her situation work. And so now, whereas her Advantage plan included that hospital, but not some of the other local hospitals, she's changing because she never wants to return again. So that's the kind of thing you want to really think about. How much does it matter to you that you use the doctors you're loyal to or other medical providers? On Medicare, you're going to get most of your health care in one place at home, or are you likely to travel for recreation or fun or grandchildren in another state? Because that's really going to be important in considering not only the plan, but which approach, supplement plus standalone drug plan or Advantage plan you're going to take. And these are the kind of things that are important to consider. And then, of course, you have to prioritize. What is most important to you? Predictable expenses, comprehensive care, including vision and dental with one single card, kind of a turnkey approach, like many of us has now. Low premiums, getting the care you need from the doctor you want wherever you are in the US. You got to figure out really, and again, write this down. What is your ultimate priority? And then what are two that are second tier? Remember, you got to also include personal needings like risk tolerance. I was sort of laughing at myself today as I was preparing for this, and I got something in the mail that I wish I could show it to you, but I'm not going to go back and forth, that I had, of course, been marketed via Facebook. I fell for it, but it's something I sort of always think about, which is what would happen if your car plunges off a bridge into a body of water and you can't open the door. And so I got this thing called self-rescue vehicle mounted safety hammer. So, I'm really not a totally risk averse person, but I do have some sensitivity to risk. Other clients, people I talk to, they may be healthy now and they're fine with taking a risk this year that's going to stay the same. Others want to be covered in terms of any eventuality, no matter what it is. So that's really something important that you want to consider. All of those things. Again, write it down. This framework is going to help you choose the right plan, or if you're working with a specialist, review and sort of figure out what among recommended plans is indeed right for you. You're going to have some parameters, and they really help. Finally, of course, the trick is matching your priorities with available plans. So we already talked about this, but more specifically, here are some questions you want to ask for your Advantage plans. The network is uber important, as are referrals. That's a big, determinant. There's some Advantage plans that require referrals, others don't. And also, how much is the plan's out-of-pocket maximum? That's something that's inching up year over year, so check it. When you're looking at your drug plans, how does the plan cover your key medications? Does it cover them? And how much will it cost? With drug plans, it's really easy because all drug plans, it's much easier, let's put it that way. All drug plans have when Medicaid, looking on the formula, which you can find online, what medications are covered, and you can find what tiers there are, and then using Medicare.gov or going through your broker or state health insurance volunteer, you'll be able to find for a few plans how the total cost compares. This is what you use to decide what drug plan to enroll in. You don't look at premium, you don't look alone, you don't look at the copays alone, you look at the total cost of the premium plus copays for your medications for the year or the period to come. So it's pretty black and white. For the supplement, as I said, the benefits are standardized and don't change. What does change is the premium. They always go up, but how much they go up year over year depends on how healthy or sick the members of that plan are in your state. Supplement premiums are set by state. And so the risk pool, the health of the risk pool, is a big component. So here are just some of the questions you want to ask yourself or your advisor when you're looking at plans for the first time or for renewal in the annual enrollment period. A good place to just get a ballpark idea or check do some early research is the Medicare site at medicare.gov. You see the URL here. This is a good one to take a screenshot of. If you look at the bottom right, you see that you need to designate what year you're looking at. So if you're already on Medicare, you want to check that you're looking for plans for coverage for 2024. It's one of the, I just had a client come to me today. She hasn't even started yet, but she clicked the wrong button and she's like, actually, no, my bad. She clicked the 2024 button. She's going to start in November. She has 2 months in 2023. I picked her the plan based on her criteria, her medications. It's the cheapest for the pharmacy she's loyal to. She's like, eek, everything's gone up so much and CVS isn't on there anymore. So, I explained to her that she's going to be in the 23 plan for November and December, and then she'll, now she can research 24 plans and find the best ones for her. So this is a good resource. Again, not until October 15th. So a good way to do this is to find a trusted, experienced Medicare guide. Another good resource is what's called SHIP programs. Each state has one. It's a state health insurance program that is volunteer-based. They cover all kinds of insurance. So, it's going to be a different perspective and experience level. Certainly can be helpful too. And then, of course, when you find your right plan, if you're renewing for 2024, you have to submit your enrollment by December 7th at the latest. Again, people lose access to the preferred doctors and necessary care and overpay for healthcare and medications they need by casually or randomly choosing or simply renewing the supplement advantage or drug plans they have without knowing what they really need and want realizing that some major changes may have happened to those plans and looking at alternatives. Now you know the 3 keys to making your Medicare plan work for you. You know how to do the annual Medicare plan checkup, and the worksheet I'm going to send you will take you through that as well as a checklist. And now, after I have really given you a lot of information, I am here to answer your questions. So I hope there's some questions in the chat. Ask away.
So far there aren't, but I do have a question, Nancy. Would you talk a little bit about special needs plans?
Sure. So special needs plans are plans for people who have Medicaid and Medicare. So if you enroll in Medicare and you have also Medicaid, you do keep that. You can stay as is, and or you can enroll, and it's important to get guidance on this because this is even more complicated. What's called, well, there are several special needs plans. The most common one is called a dual, that is Medicaid and Medicare special needs plans. And that's an Advantage plan. And it gives people access to additional benefits. So, for example, a cash card, basically they can use at CVS or other places every month. They have a medical coordinator and this kind of thing. The availability of other kind of special needs plans depends on what state you're in, but they can include chronic needs special needs plans that can range from diabetes to, diabetes is really the one I see most often, but and these are really pretty restrictive. So those are really the most common kinds of special needs plans.
Also, feel free to unmute if you have a question.
I actually, mine says that the chat has been disabled. So
yes, chat is disabled.
Okay, we thought we had resolved that problem. So by all means, unmute and ask your question.
Okay, so long as I'm hogging the line now, I actually have 2 questions. But first, thank you for actually what's an overwhelming amount of information. I'm going to have to listen to this a second time, I think. But yeah, 2 questions, and you kind of touched on this one, but in terms of folks who are in the, I'll call it the go-go years, right? Like, yeah, we're going to spend a month with this grandchild in this part of the country, and then another grandchild in that part of the country, and traveling a lot. Are the Medicare Advantage networks, are they national in scope typically, or are we just thinking that if you're in your go-go years, Medicare Advantage, because of the restrictive networks, are kind of maybe something that aren't for us? And then the second question, and then I'll put myself back on mute. As far as things like elective surgeries go, where does one go to kind of say, hey, look, I know I have this particular issue. It's something I got to find out whether it's covered or not, though, because it's kind of an expensive thing. Where can I go to see whether detailed coverage, I guess, is the question I'm asking for. So I don't know if I'm being clear about that or not.
Yeah. Well, I think so, Bill. You'll tell me when I answer you, and please redirect me if needed. So your first question is a great one. So supplement plans give you, I'd say, the greatest amount of flexibility, but they're actually also Advantage plans, as you might imagine, from the big companies. Those are the ones I represent. I like solid national companies, in addition to Blue Crosses in some states, but that do have national networks that you can utilize if you're elsewhere. Okay. Now, your second question, when you're evaluating plans, whether you're looking at it yourself or you're working with someone like me, there are the detailed charts, let's say, of what's covered and what's not, are in something called the summary of benefits. And an even greater level of detail can be found in something called the evidence of coverage. Now, if you have an Advantage plan, it's just that plan from that insurance company that make those decisions. If you have a supplement covers the same things that Medicare covers. And so there is a page on Medicare.gov that's called What's Covered. Believe it or not, on Medicare, for example, the traditional annual physical is not covered. You get an annual wellness exam where the doctor cannot touch you, and you don't have any tests or imaging or anything. But if something's discovered or needs to be dealt with in depth, you really need to make a follow-up appointment, at which time, in a diagnosis-related context, all of that stuff will be done. So that's a big surprise to people.
Hi, I have a question regarding whether to stay with a company benefit plan versus choosing one of the Medicare options. How do you know which should?
Sure, that's a great question, and it's not as black and white as one might think. And so I appreciate you asking that, Ed. First of all, there's certain guidelines, as you can imagine, as to who has to enroll in Medicare, even if they work for an employer firm. If you work for a firm that has fewer than 20 employees, and you don't have health insurance through a partner whose employer has 20 or more employees, then you have to go on Medicare. Otherwise, let's say, a lot of people who are self-employed, even if they have an LLC or K1 partnership status, they have to go on Medicare at 65. If you do not enroll in Part B at that time, Part A and B, you will be penalized significantly for the rest of your life. However, if you work for an employer or your partner does, and you are insured by your partner's insurance, or have that option with 20 employees or more, generally, it is generally less expensive, to make a vast generalization, to stay with that employer insurance. That employer insurance may be crummier, and you will probably pay a lot more in copays, but I'm always glad to do an analysis of cost and coverage for anyone of the employer insurance, in the context of your own healthcare needs of employer insurance versus Medicare and a supplement or a Medicare Advantage plan. Keep in mind, one key fact is that the premium that you pay to the federal government for Medicare Part B, and you have to pay that whether you stick with original Medicare plus a supplement and a drug plan, or have an Advantage plan. You have to pay that. That is an income-based premium. This that's based on your figure. That's mostly your adjusted gross income from 2 years back. That's a whole other can of worms. Glad to talk to anyone about that later. But sometimes if you're a high earner, then your Medicare Part B premium can be way pricier than you ever imagined. On the other hand, if you're part of a small firm, or you've been getting your own insurance, non-subsidized, or through the exchange, you're going to be really happy to switch over to Medicare because it's great coverage for less in general.
I have a
Thanks so
question. Sorry. Can I ask my question?
Yes, please. Of course.
Great. So I was very happy to get a plan last year that lowered my drug costs. Thank you again, Nancy. And um, I can go video. And sorry, I'm confused with the video.
No
And
worries.
and um, and I'm looking at the Medicare website, and I see my current plan is there for the RX. Or is everything that is an option for me for my Part D? Is everything that's an option for me going to be visible on Medicare website?
Medicare.gov.
Yes.
Karen, yes, it will. But like I said, the info you see up there now is likely to be wrong.
Understood.
So hold off. But yes,
Okay.
it is.
Okay, good.
Yes,
And
it is.
follow up to that. When I look at some of the plans, I can see that, and again, I understand that the 2024 will better to look at it after the middle of.
Yeah.
But I can see that some of the plans, there's not that many. Some of them have lower monthly premiums, and they also have lower deductibles. And yet the annual cost is higher. How can that be?
Because they have higher copays. So really, you don't want to look at those individual components. You just plug in, if you're looking at a drug plan or an advantage plan on Medicare.gov, whether because you need to pick it out yourself, or for whatever reason, you enter carefully all your medications with dosage and frequency, indicating if you're okay with generic or not. You've already entered your zip code, and then basically you choose your pharmacies. I recommend you always include a CVS and Walgreens, just so even if you think you love your local mom and pop pharmacy, because when you see the price difference, you might not love it so much. And then click submit. And what you're going to get is a list of drug plans. And right up top is the plan that is the least expensive in terms of total cost for you with your current medications for the year to come. Or if you're new to Medicare and you're enrolling mid-year, for the period to come. That includes premium, copay, and deductible. So on deductibles, the federal government, as phase one of the 3-tiered coverage plan for medications, sets the maximum, the ceiling on the deductible. So every year they do that. 24, it's going to be $545. Most plans have that because why not? But you don't have to worry about that. Just go for that plan that is the least expensive total cost that's shown at the top of the list.
Great, thank you.
Sure.
This may be a basic question that I should know the answer to, but I don't.
You shouldn't. Why would you? You're not even 65 yet. I happen to know.
Well, that'll be our secret. No.
Okay.
I was lucky enough to be able to do early retirement, but my wife is the one that's supplying our health insurance through her company, which is a wonderful plan. Excuse me. So now when I go on Medicare, should I tell her, hey, you know what, just pay the single premium, or should I say, no, continue covering me? Is there
in most cases, like I said, I'd continue with it, but I'll be glad to take a look at that, do a quick analysis of cost and coverage of both. One thing, Bill, that you might want to consider is if anyone is going to stay on employer health care, again, that requires your employer or your partner's employer, if you're being covered by your partner's employer's insurance, must have 20 or more employees. That is loosely defined. They can be part-time, full-time, whatever. If you're going to do that, there is an option. First of all, a lot of people are going to say you have to enroll at 65, and if you don't, you'll be penalized. Not true. If you're covered by the kind of employer health care I mentioned, you don't. You have what is called, what is considered as coverage that's equal to Medicare, and you're fine. You will not be penalized. So ignore those people. There's a lot of much more misinformation out there on Medicare than there is correct information. But let's say you're going to stay, Bill, on your wife's employer's health insurance. It's a great plan. You would want to consider, should you enroll in Part A, which is hospital room and board? The reason to consider that is that anyone who has been employed on, kind of on the books for 10 years or more has paid the premium for Part A already out of your paycheck through your FICA taxes. So Part A, which is hospital room and board, is basically everything to gain and nothing to lose, except if you or your partner, if that's whose insurance you're on, are contributing to an HSA, a health savings account. If you're doing that, I don't really get why, but that just is like oil and water with Medicare Part A. You can't do both of them. So if you're that HSA is in play, just forget Part A, and you'll enroll in Part A and B when you no longer have access to that great health insurance through your wife. Any other questions?
Yes, I have another question. I've just applied for Social Security. I'm officially retired, and they said they're going to automatically pay. My Medicare is going to be paid through Social Security. It's going to come out of my Social Security payments. So I never considered the Medicare Advantage plans, and I don't know that I would. But in any case, I'm paying for Medicare A and B anyway, right?
Well, as I said, there's no premium. You've already paid the premium for Medicare Part A during your working years, and that you've already paid it for the duration. So you are paying for Part B, whether you have a supplement and drug plan or an advantage plan. You must pay for Part B.
And so the difference, and the difference between my Medicare with the supplement versus an advantage plan is the D and the G. Is that right?
Well, this not exactly. Let me I'm gonna stop sharing. That's a huge question, but let me try and answer it in a brief and accessible way. So, when you enroll in Medicare, first of all, by the way, you do so through Social Security. So if you haven't already and you're going to be new to Medicare soon, make sure you have an account that you can get into at ssa.gov, because they operate in very early 20th century mode. And if you can't get in, they mail you a method of recovering your password. But Medicare is managed a lot better than that. Don't worry. So Karen, for anyone who is actually taking their Social Security benefits, then it is your Medicare Part B premium that is automatically taken out of your Social Security benefits. If you wish, you can also have, if you have a supplement plus standalone drug plan or an advantage plan with a premium, you can have the drug plan or the advantage plan premium taken out of your Social Security. You cannot have your supplement that's purely private taken out of your Social Security benefit. Mm-hmm. And so the combos, just to go over it again, the options are like this. So first we start with original Medicare Parts A and B as the foundation. Because that doesn't cover everything, we need something else to cover those very expensive components, or proportion, let's say, not covered by original Medicare A and B. The options are the supplement. Most comprehensive supplement is Plan G, plus a standalone drug plan. That's like an unlimited mobile phone plan. With a plan G, you pay once at the beginning of the month, and after a $226 annual deductible, you have access to all the healthcare, medical care you need without additional cost. The other option is an advantage plan that's privatized. And in that case, Medicare hands over management of your Medicare to the insurance company. They can really serve, a role for people. Sometimes the premiums are often as little as zero. It's a pay-as-you-go model. Believe me, there's no case in where you get something for nothing. It's more like a payphone. So you pay as you go. And if you get sick, you're going to pay more with an advantage plan than you will with your supplement. So it's all a, sort of a trade-off, which way you go.
Got it. Thank you.
Sure.
Nancy, I've got another question.
Sure. Great.
So if I understood you correctly, because I was with a gentleman who was asking about if you stay on your partner's policy, you said, and I mean, maybe I got this wrong, but you said consider enrolling in Part A as well, which is the hospital room and board, because you've already paid the premiums throughout your working life, so there's no additional premiums. Is that correct?
Yes. The only reason you wouldn't do that at 65, if you're covered, by your partner's employer health care, over 20 employees, is if your partner is contributing for you to their HSA. Now, in some situations, they don't have to designate who those monies are for. So just, kind of ask your partner about that.
Okay, but if you don't have an HSA.
If you don't have an HSA, go ahead and enroll in Part A. If you have a heavy duty hospital bill, it may kick in and help, but again, there's no cost. So there's every reason to do it.
Okay, that's great. Thanks.
Sure. Any other questions? Okay,
Nancy,
well, listen. Oh, I'm sorry. Go ahead, Joanne.
No, I just didn't know if you wanted to maybe mention appeals. If your claim is denied.
Yeah, not really, because that is like digging way into the weeds, and I just don't want to divert. Do you have a specific question on that, or?
No, I wasn't sure if it would apply to tonight's talk. So
yeah,
okay.
I don't think so, but I'm always glad to answer that offline.
I've got a question, Nancy.
Sure.
So for the supplemental, Medicare and supplemental, I was told that there was a plan G and a plan N, I think, and the difference being the copay. Is that the only difference? No,
it's not the only difference. So just to clarify for everyone else, Plan G, there are no copays. You pay that $226 annual deductible, and you're good to go. With Plan N, which is less expensive, and in some states like New York, supplements, which has great consumer health protections in general, including in terms of insurance, that means premiums are higher, including their Medicare supplement premiums. So in New York, when the difference between a Plan G and a Plan N, which has more out-of-pocket costs associated with it, can be more significant. A Plan N, you do have to pay a copay for visits with providers and to the ER. The copay this year is about $20. Some people, to some people, they never go to the doctor, or rarely. That's nothing. The other thing that's more important is that the excess charges at up to 15% above Medicare reimbursement rate, that is your 15% of the bill, that is your responsibility, is not covered by Plan N. Now, there's some states, about 8 states, where there are no excess charges. Ed, where are you based?
New Jersey.
Oh, okay. Well, we have excess charges, but let's say in New York, there are no excess charges. So a Plan N can sometimes make sense there.
So
But
it wouldn't make sense.
it does present a risk in much more significant risk in New Jersey, because providers do charge the excess charge in some cases. It's optional. But my gut is they're going to be charging it more. And remember, you can't easily just assume you're going to change from one supplement to another. You can typically change down in coverage, for example, from the more comprehensive G to an N, but without underwriting. Sometimes you can do that, but not up. So, again, that's all part of what kind of risk you're willing to take, in terms of the cost and how do you weigh all that. Always glad to talk that through with you.
Thank you so much. That was very,
You're welcome.
very clear.
Nancy, thank
Okay.
you. Yes, I'll pass
you're
along your
welcome.
email when I send your, I'll send everybody the information that you give me. And I'll email that to all of you, including Nancy's contact information if you have any further questions. And
Great. And Joanne, any idea when the video will be available?
that's up to our IT guy and when he has time to upload it. So hopefully
Okay.
I'll get on his case, and hopefully by midweek next week.
Okay, and then you'll email that out to everyone
I will.
as well?
I'll send that link.
Okay.
Yes.
Okay, fantastic.
Thanks so much, Nancy. This was great.
Thank you
Well,
so much.
thank you
Okay.
so much for
Thank you.
joining me.
Nice to see you.
Okay,
Okay.
Good
bye-bye.
night, everyone.
Good night.
Enjoy.